Welcome to Dr. Shekhar Saxena, Director of Mental Health and Substance Abuse at the World Health Organization. Dr. Saxena, thank you very much for joining us today. What have been some of the biggest misconceptions you have come across during your experience as a leading voice in the mental health space?
There are many misconceptions around the area of mental disorders and mental health, and correct information amongst general public is rare to be found actually. Some of the common ones are that people think mental disorders are rare. They're actually not rare. Almost 1 in 4 people sometime in their life will experience one of the kinds of mental disorders. Amongst 5 families, there will be 1 family which have a person with mental disorder. That's pretty common. Second misconception generally found is that mental disorders are not real diseases. They're not as real as physical diseases, which is quite incorrect again. Depression is as real a disease as diabetes. So there are specific causes, specific symptoms, and specific natural course of all the mental disorders, which is very similar to physical disorders. Some other people believe that mental disorders are not treatable. Again, incorrect. There are very effective treatments for mental disorders by medicines as well as by psychosocial interventions, and they are comparable in their efficacy to many other physical disorders. So these 3, I would say, are the common misconceptions which are present amongst general public, but also amongst policymakers, which matters quite a lot.
Thank you very much. And how do you assess the role of the media in portraying mental health issues?
Yes, the influence of media is strong, both in positive as well as negative manner. Some of the positive things which media does and could do more is to remove the misconceptions that we just now talked about, to give correct information and to orient people towards looking at mental disorders as real disorders for which much can be done. Unfortunately, sometimes the media mystifies mental disorders and in some way tends to present it in a sensational manner. That does a lot of disservice because people, instead of understanding what mental disorders are, seem to be awed by it, seem to be afraid of it, which does a lot of disservice. Similarly, media in many cases glorifies negative things about mental disorders, for example violence, for example suicide, and that does a clear disservice to the community for mental disorders. So I would say that media is already doing a good job, but it certainly could do a better job.
Do you think that non-specialized healthcare providers are able to provide basic mental health care? If so, could you provide any examples?
In fact, we do believe in WHO that much of the mental health care, at least the basic ones, can be delivered within the hands of non-specialized healthcare providers. What do I mean when I say non-specialized healthcare providers? I mean the general doctors, general nurses, and in many countries, healthcare workers and volunteers who form the frontline mental health team. We've done a lot of review of research in this area in the last few years, and we have concluded that between 60 to 80% people with mental disorders can be provided adequate care within the hands of non-specialized healthcare providers with some assistance and support and supervision from a specialist, which is possible, which is perhaps the only model for low and middle income countries, because there are not enough specialized providers and there will be none in the next many years' time. So the system has to depend on whoever is providing that kind of help, but our review suggests that that is not only desirable but is feasible, that can be done. And it's being done in many countries. I would like to give you the example of Sri Lanka, a country with 19 million people in Southeast Asia, which have very few psychiatrists, and many of them are concentrated within the capital city. So out in the field there are very few psychiatrists at all, if at all necessary, if at all available. The government of Sri Lanka decided many years back that it has to train medical officers in providing mental health care, and it systematically trained hundreds of them who are based within the primary healthcare facilities and are adequate to screen, identify, diagnose and treat the majority of mentally ill people. So much so that the number of people who had to initially travel from wherever they were living to the capital city and get admitted in a mental hospital has decreased markedly, which is better because more people are being treated, which is better because more people are treated where they live rather than have to travel to a distant city and at a cost that is affordable to them. It just makes a lot of public health sense to devolve the care within the hands of non-specialized healthcare providers, not only in countries which have a lack of specialists, but also in many countries which have a lot of specialists, because a number of people in families will not go to the specialist. They will depend on their general doctor, and if the general doctor is more aware of these problems, is able to provide care, that really makes a lot of public health sense. So from WHO side, we definitely recommend that, and we believe that is feasible and cost effective to do.
But so, don't you think that patients could fear disclosing symptoms of a mental disorder to their general physician? Because we know that this can actually lead to stigmatization.
I do believe that the general doctors and nurses who are more in touch with the patient and his or her family and know them better are actually in a better situation to provide the kind of psychosocial assistance and insights that are necessary. A psychiatrist who's seeing the patient for the first time will perhaps require a lot of time in understanding the problem and in coming to a conclusion about what needs to be done. His or her skills will be more specialized, but the requirement of time will be more actually in his hands. A doctor who has seen the family and the patient for some years maybe already knows a lot about the family and the patient, and it will be easier and more effective for him or her to make the kind of suggestion which might alter the way people look at their day-to-day problems, their mental illnesses, and can do something about it. Also, the suggestion from a person you know better is more readily accepted than from a super specialist who you don't know that well. So from many aspects, the general doctors are in a very good situation to treat and to provide assistance to a number of mentally ill people. Of course, in some cases, the specialist will certainly be better, which requires more complex kind of analysis, more complex investigations and treatment. So there is a balance between the two.
So allow me to follow up on one point. How can patients establish empathy with a general physician if somehow they may fear that these general physicians lack the appropriate knowledge of a specialist?
Also, we have to consider the fact that going to a specialist, maybe a psychiatrist, is often very stigmatizing. And many people, including families, would not like the person who has a problem to go to a psychiatrist just because he or she will be labeled for life as suffering from mental disorder. And going to a general practitioner nurse is like going for fever or like going for back pain, which is much simpler, much easier to accept and not stigmatizing.